you for joining and watching us today. It's October, Breast Cancer Awareness Month. And at Elements this year, we wanted to do a bit more than just movement classes. We wanted to share the journey of people in our community. And in hopes that those who have been diagnosed feel less isolated, also normalizing talking about breast cancer, and also for those of us who are teachers, caregivers, family members, just to have a little bit of insight, perhaps a deeper understanding into the journey so we can be more supportive as well. So today we have Jessi White, and I'm very excited because she is the newest member of our Elements family. And Jessi received her doctorate in physical therapy from George Washington University School of Medicine and Health Science in 2015. And she happened to be in the same class as Michelle Fry, who's also a PT at Elements. So we're very excited. She is certified myofascial trigger point therapist using dry needlings, in addition to manual mobilization techniques, biomechanical evaluation, therapeutic exercise, activity retraining, and she uses all of it in her treatment sessions. She has 25 plus years of dance training and performance experience with extensive knowledge of Pilates mat and reformer, yoga, floor bar. And she also became progressing ballet technique certified instructor in 2017. So she specializes in treating performing artists, providing injury prevention, screening, strength and conditioning, both in the clinic and backstage during performances. She continues to take dance classes, both for fitness and to stay connected with the local dance community. And we hope someday soon she will also take the diatonic training. So welcome, Jessi. We're so happy to have you here. Thank you for joining us. So I'm going to dive right in and take you back to the beginning of your journey. First, I'm just curious kind of how you got diagnosed. Were you doing a routine mammogram? Do you have a family history? Did you have a suspicion? And then, you know, how that initial diagnosis came about, and also what was that initial diagnosis?
Yeah, so I got diagnosed with breast cancer at the beginning of 2020. So I had actually found my lump probably late November 2019. I wasn't doing a self-exam per se. You know, sometimes you just like take your bra off at the end of the day, stretch and, you know, move. And I was like, that doesn't feel right. And I thought, is that the same on both sides? And so I was kind of, you know, poking around. I thought, well, maybe there's something there on the other side. So I just kind of like let it go. And then I realized that that had been around the time of my monthly cycle. So I thought it's probably just nothing, right? Like it was probably like breast tenderness. And so then again in December, I felt it. And I thought, you know what, like, I'm pretty sure that's something. Let me get it checked out. And so, of course, it's the holidays and everyone's busy and doing stuff. And the first breast exam that I could get was not until March of 2020. And I kind of had a mini panic attack. And so I actually went to an urgent care and had a breast exam. At the time I was 37, and I was like, you know, technically I'm too young to get a mammogram, but the physician was like, yeah, she's like, it's probably nothing. You know, lots of young women have dense breast tissue, they get cysts. You know, I don't have any children. So she's like, you know, it's not a clogged milk duct, because that's another common, you know, thing that can be a lump. And so she went ahead and just ordered the works. She's like, let's just, you know, make sure everything's fine. And so I went in for a mammogram. And sure enough, I have dense breast tissue. And so then they were like, well, let's do an ultrasound. And the radiologist was like, let's do a biopsy. And that's when I was like, oh, this is like a thing. This is serious. Like, you know, so she did a punch biopsy, and that was on a Friday. And she was like, it usually takes like 3 or 4 days to get back. So probably like middle next week, we'll give you a call, you know, whether it's negative or positive, like, don't worry about it. And on Monday night, I had 4 missed calls from the radiologist. And I was like, there's no way that is good news, right? There's no way. And so like I had worked the next day at 7 a.m. So I went into work on my lunch break, I go into an office, call the radiologist, and sure enough, she's like, you know, your biopsy came back positive for breast cancer. And then it was kind of just a whirlwind of, she's like, we've got these other lumps, and we, you know, like, let's biopsy all of these other things. And thankfully, after four punch biopsies, 2 in the left breast, 2 in the right breast, only the first one came back with cancer cells. So that was good. But at that point, we were getting into late March 2020, right? Ooh. Things are swirling in the air. There's like, you know, coronavirus in the West Coast. They're starting to report it on the East Coast in New York. And basically things are starting to shut down. And so I actually opted to start my treatment with a mastectomy with reconstruction so that I could easily take myself out of the clinical setting. I would need 6 weeks of recovery from surgery anyways. And that also gave me time to decide what else I wanted to do, right? My husband and I had literally just been thinking that it was time to finally start a family. We were, you know, in our 2nd year of marriage, and, you know, we're feeling like it was a good time to start. So we knew that there was options about fertility preservation, but just like working all of the details with hospitals closing and things becoming elective, even though they weren't technically elective. That's where I started. And so when I met with my breast surgeon, she was the one who kind of like laid everything out. After they did the testing of the cells, they diagnosed me with triple positive ductal carcinoma, which basically means that the cancer cells were found in the milk ducts as opposed to in the glands or the lobes. Triple positive means that it was positive for estrogen receptors, progesterone receptors, and then a protein called HER2/neu, which basically is a protein that creates like rapid cell division. So I had the potential of having a more aggressive cancer because of that. And so after kind of finding out like what type of cancer it was, we did an MRI to see how big it was. And it was, I'm going to forget now, I want to say approximately 2 centimeters, which made it a grade 2. And they weren't quite sure the way that the cancer is graded is, you know, like based on how big it is and if they find cells in other locations. So since I started with my surgery, they were able to actually remove the entire tumor. And they also tested for, what is one of the words I'm looking for? Oh, they injected radioactive dye around my areola, which was the most painful thing I think that I had experienced at that point, so that they could trace it into my lymphatic system. And so they went ahead and took the first 3 sentinel lymph nodes, right? So the first 3 that basically became radioactive, they took those out so they could biopsy them and just see if there were cancer cells at other places. And I had microscopic cells in one lymph node. And then I'm not quite sure how she said, she was like, you have a trace of cells in the second. And I was like, I don't know what a trace of a cell is, but that basically put me in the 2B category, meaning like one grade right below a 3.
Right.
So still early, but not as early as it could have been in my diagnosis process.
That's a lot to swallow when in, what was it, December, November, you're kind of like, it's probably just my cycle, all the way up to
Right.
4 biopsies and surgeries later. So you kind of answered this already, but when you first got that diagnosis on the telephone at your lunch break, did your heart sink then, or was it later, or was when it, when was kind of the most, I guess the whole thing is very emotional, but what part was most kind of heart sinking for you?
Yeah, I mean, it's months, and for some people years, of an emotional roller coaster. That initial phone call, I think I was so in shock that I wanted to cry, but instead, like, my body just was like shaking profusely, and was thinking to myself, how am I going to go back and treat my patients right now? And then also having to actually like start to verbalize to people, I have breast cancer. Like, that was so hard. And I was like, it's, of course, you start like consuming information profusely, and there's all sorts of emotions that go along with that. I think that initial thing was kind of like the most unsettling. And then because things like went so quickly, I kind of like didn't really think about it for that next like month or so, because it was like test, rearrange my schedule, like take patients off this day, put them, like double myself on this other day, like just trying to get so that I could make all these appointments. And then I think the thing that was probably the next most difficult was actually coming home the day after my mastectomy, which I didn't. My husband and my mother came and they dropped me off at the hospital because no one was allowed in.
Over COVID. Oh.
And they came and picked me up the next day. And like once I like got home and like kind of got into my house and like settled, I was like, okay, this is real. I literally just had a part of my body cut off. Like it's only like the journey has only just begun. So I think that was like the hardest. And it was like probably a good week or so of just like waves of emotion, just like, breaking down in tears and just realizing like this is my life for the next year.
Yeah. And so did you get the reconstruction during the mastectomy at the same time?
I did. And part of that was, I had been originally scheduled for surgery mid-April, and they bumped me up to April 1st because it was the last week that they were going to allow the cosmetic surgeon in the hospital. And they were like, if you don't get it now, you don't get reconstruction until some other time. And so they were like, it's done all the time. Like, we're not worried about, you're young and healthy and your skin looks healthy. Like, oftentimes we will put something in there temporarily before we put the implant in. But they just did it all one go.
And you go home from the hospital, you have drains, you have a ton of instructions probably, and it was a whirlwind, not even sure what just happened. And how long until you felt kind of a little bit ready for life? I mean, I guess there was a pandemic, so it's a little, how long until you went back to work?
So I actually started back to work 8 weeks after my surgery. And I actually wanted to go back at week 6. Sorry, I'm sliding on my chair. Because what I realized is that the longer that I was at home and the longer that I had to think about myself, the deeper my dark sinking hole became. And I needed somebody else to think about. Like, it's hard to be like, it's hard to be focused on like all of the things that are happening to you when you have somebody else to think about. And I needed to get out of my own head. So as soon as they would let me get back to work, my surgeons were like, you're a physical therapist. Like, you really don't necessarily need to be like pushing and pulling and lifting and like moving. And I was like, I'll be careful. Also, you don't know this, but I've been at home doing all of those things already, very safely, but I'm ready. So it was really more of like getting my schedule back open. I started out doing televisits and then as well as in person. So it was just really kind of like also getting the patients who wanted to be in clinic on my schedule and getting those who wanted to be virtual on my schedule. So once that was kind of, that groundwork was laid, it was probably about 8 weeks.
Yeah. So you kept moving, it sounds like. Was there kind of a movement practice or something that you continued to do that helped?
Yeah. So, I mean, at first I just kind of did what I honestly, I was like, I can move my lower body, right? Like, it's not my lower body that's the issue. To the point where like, you go in for like week 1, week 3 checkup, week 6 checkup. And literally like the doctor's like, oh, how are you feeling? And I'm like, okay, so I've been like squatting and lunging. I didn't tell them that I had been dancing around in my living room with my arms crossed across me, just like dancing with my legs.
I love PT.
That would like get to them, which I don't actually advise that. I did actually end up with a seroma, which is basically just like a pocket of fluid. So they did 2 incisions. They did the incision where they removed the breast tissue, and then they did an incision under my armpit where they took the lymph nodes out. And that area, because it is where you have a cluster of lymph nodes, and I guess I was moving too much, became inflamed. And I did get a pocket of swelling, and my surgeons were like, and I was like, okay, I get it, doing less.
Yeah.
And I actually, now I think some of it is scar tissue, but I do still have a little bit of like thickness in that area where that seroma had been. So to anyone out there who is in the process of planning their surgery, like,
take some time to heal.
Give yourself some time to heal. Yeah, but and they basically were like gentle upper body motions. They encourage you to start walking immediately, right? They're like, go out and go for a walk. And that was actually because I had that seroma developing. I actually had to use compression on it because just the motion of regular like swinging my arms would irritate it. And that developed like around like the 2nd week post-op. So yeah, it was like whatever felt like I could do mentally and physically. Like there were some days where I knew that if I moved, I could at least get some endorphins going, and I would like, feel like terrible. But yeah, because it also takes, it takes a lot of energy to move. So it would be like, okay, I'm going to like just do I'm going to do these 3 stretches. And then an hour later, you're like, okay, I did 3 stretches. It took me an hour.
Yeah.
So
So if there was something you could tell yourself, so it was about a year. Wait, are we at a year? Yeah, year and a half. What would you want yourself to know kind of early on?
I think, this is actually, I have thought about this. And it's hard because I don't know if I would have like accepted anyone's advice, if that makes sense. The thing that kind of keeps coming to my mind about like, what do I wish I had known before this is actually doesn't have to do with my with my diagnosis, but more like with me as a healthcare practitioner, which is, and I like literally, I'm ashamed to admit this, but I have had numerous patients who have gone through breast cancer treatment, and without really thinking it, somewhere in the back of my brain, it's like, well, that's the easy cancer. Like, where did that come from? Right? Like that was like, and I just remember just kind of being like, oh, okay, so you have a history of breast cancer, and and being like, are you in remission? Which is kind of the other thing that I have learned that I didn't know before, which is that with breast cancer, so typically, if someone hasn't had symptoms in 5 years, they are considered to be in complete remission. But with breast cancer, because it's hormone based, basically, until you have a complete hysterectomy and you cannot produce those hormones, you're always at risk. And so also not realizing, right, like that's even if somebody said like, oh, I had breast cancer 5 years ago, that they actually may still be on systemic therapies, that they may be going through, other side effects to treat, to lower their risk of recurrence. So not exactly like about me going through my own treatment course, but more about stupid me before, who just didn't know enough about breast cancer to realize that it's not just like, oh, you have a tumor and it gets cut out and maybe you have chemo, maybe you don't. Because especially as women get older, they don't necessarily do chemo and radiation. Sometimes they do just have either a lumpectomy or a mastectomy. But women in their 30s and even their 20s are getting diagnosed more and more. And that's, 20, 30 years of living with potential hormone therapies to reduce the risk of recurrence.
Yeah, that's important. And I think that's part of the reason why I wanted to do this as a PT. I want to hear from people who've been through it, what you guys have been through, because if I just say, oh, you've had breast cancer, okay, and it's just like a stack of past medical history and you just kind of keep going through it, blah blah, check. So yeah, and the way to get diagnosed is improving, which is great because we can catch it earlier, but that means we're catching it earlier. So yeah. So other than your mom and your husband, was there something that really helped you, someone or a website or a group or your doctor, some organization that helped you get through the initial treatment?
The internet was basically all I had. And I ended up starting my own kind of cancer related Instagram called Reflections from Cancer. And some of that was also because I had a classmate in PT school who basically had the same diagnosis 2 years before me. And in talking to her, so that was actually really beneficial to, like, when I got diagnosed, to be able to be like, how did you do this? And kind of seeing where she was at on the other side of things. And so she was definitely helpful, but she was like, I started blogging, I started posting, like having that outlet of basically being able to like put things into the world. Like, this is what I'm thinking and feeling. And whether someone likes my post or not, it's not inside. Like, I'm not just like, trying to like keep it all in. So that was actually really beneficial. There's not a ton of stuff on my Instagram, but there's, especially when I was like really struggling, I was able to like put it out in the world and be like, okay, now it's not just me that knows. And then there's actually several organizations. I didn't actually end up using the Smith Center as much as I had hoped to, but they had a lot of support groups. And then I also found through Inova Fairfax, they have a series called Life with Cancer, and they were an incredible resource. I didn't get my treatment at Inova. I got my treatment at Sibley, and they were like, this is for cancer patients. Like, we don't really care if you're getting treatment with us, which was really, which was really helpful, because you don't want to feel like, oh, well, I'm getting excluded because I'm not giving my money to you. And so there was just a young women's breast cancer support group that's actually meeting this week that I'll be participating in. So regardless of where you are at in your diagnosis, treatment, recovery, they're there, and it just kind of gives you someone to talk to or to listen to. Sometimes it's nice to just listen and be like, oh, I'm not the only person who's going through this. Okay, good. And then they also offered, Reiki and massage and acupuncture and things that were free and or low cost, which was really great. So that's my plug for Life with Cancer. They were pretty incredible. So those were kind of my two go-tos, a place that I could let my emotions out into the world, since I didn't have people physically around me, and then kind of my online support group.
Yeah. So that's really all the questions I have. I don't know if there's anything else you want to share. Anything you want to talk about now that you're currently still working on, or Jessi's going to be teaching a great class at the end of the month. If you're currently in chemo, it's exercises that are safe and effective during that process. But besides that, anything else?
Yeah, I mean, I think that is probably a good, like, movement really has always been a part of my life. And so being able to find movement that was safe throughout this process helped me, as well as, some of those other things that we just discussed. So I just think it's kind of important to find like what is good for you. I've also reconnected with some things, that I had kind of let go by the wayside that were my more like artistic side. Like, once I put on my doctor brain, you kind of like forget how to be like crafty and creative. And so that was also really good to just kind of reconnect with that side of me throughout my treatment, and just, realize, and I think everyone kind of does, but that but I didn't do this to myself, right? Like everyone who goes through cancer has a moment, and I sure did as well, of being like, did I do this to myself? Like, what did I do? Especially when I had zero family history of breast cancer. So, you know, they did a genetic study. I had no like genes that were, you know, they'd like not only test you for BRCA, they test you for all of these other like minor cancer related genes and nothing. And so then they're like, okay, well, if you eat healthy, you exercise, you minimize your alcohol, and you don't smoke, then you're at low risk for breast cancer. And I'm like, okay, so like I have to stop drinking, right? Like, it's like, I have one factor here that, you know, put me at risk. And then you have to just be like, no, that's not what this was. Like, you didn't do this because you drank too much in college, or, you know, 2 glasses of wine after dinner instead of one. Yeah, but it's okay to feel like, you know, guilty, and then just get on with it and realize you're not.
Yeah. Well, thank you, Jessi. This was really helpful, really informative, and thank you for sharing. I know it takes a lot of courage and chutzpah to get out there and share in the world. So I appreciate it, and I think it'll really help a lot of people to hear what you've been through and are going through. And I know for one, I'm so happy to have you at Elements. Yay!
Thank you.
So I'm looking forward to spending more time with you as the years go on. So
Yes.
we'll see you at the studio.
Okay.